gang. Let's take it to the phone line and talk story with our friends, the health professionals from Maui Health. I want to say good morning to Dr. Vijak Ayasanonda. Good morning, Dr. V.
Good morning. How are you?
Doctor, what kind of a name is Vijak Ayasanonda?
Originally, Thailand. I was born in Thailand, and my parents brought me over. Grown up in the U.S. ever since one.
You know, I'm very intrigued with other languages that use the same vowel concept as the Hawaiian language, the a, e, I, o, u. So, yeah, that's why I had to ask before we get to our questions. How you doing, Dr. V? All right, buddy, here we go. First question is my question, doctor. How's the traffic doing in and out of the emergency room? Is it more than usual that we've seen since the COVID-19 virus took effect?
You know, our traffic is still not very high.
Okay.
What we had before was a lot more. Like we would see, at most was like 160 people, 130 to 160. But lately we've been probably in the 90s to 100 range. I mean, a lot of folks are starting to have a little bit more trust and come in for all sicknesses. And I'm happy to not see people who waited too long.
True.
But, you know, I can't stress enough. We're doing everything we can. I really think everyone who thinks they have an emergency, please feel safe. We do everything we can. I personally oversee everyone in the emergency department coming in to make sure that we can get everyone taken care of appropriately as soon as possible.
Awesome. And we thank you guys again for all of the great work that you are doing up there at the hospital. All right, this one comes from Pua, Dr. V. Do healthcare workers anywhere in Hawaii get a rapid test daily upon arrival, or do they get a little temperature zap on the forehead and move on?
From what I know, I don't know of anyone who's doing a daily rapid test, but I can't speak for every healthcare worker across all of Hawaii. And I think temperature zapping on the forehead is becoming a more mainstay, you know, from the airports, the restaurants, and a lot of healthcare facilities. Now, at Maui Health facilities, of course, all of our staff, doctors, everyone goes through a screening process when they come into work. So before they're allowed to enter the building, you know, you come up and we talk with one of our nursing staff, go over a list of symptoms, make sure you don't have anything, cough, shortness of breath, COVID exposures, for example. And then you do get your temperature taken. It's not a rapid test, but it's a screening process. And, of course, anyone who has a temperature, be it visitors or anyone else, they're not allowed to enter the facility. And all of our staff are then flagged and asked to visit the emergency department where they're seen by one of our advanced practice providers. And if appropriate, they get a COVID-19 test and are not allowed to go into work until that test is either negative or they don't have any symptoms.
Yeah.
Now, just addition to that, we do have some additional help now that we've had this little surge that travel nurses are being brought in to help us out at the hospital and across Hawaii. And at least here, any travel nurses are given a COVID-19 test when they do arrive, and they can't start working until it's negative. We ask them to get tested again on day 6, and are, of course, asked to quarantine for the first 14 days they're here on Maui, except for work. Make sure they take their temperature twice and log it in with our employee health department. And as long as they don't have any symptoms, they're allowed to work, you know, until they have 2 negative tests before they're clear. Now, we've done mass testing, like I think I told you the last time we were on the radio, that we are testing all of our employees, both clinical and non-clinical. And also any of our employees in those high-risk areas, they're getting tested more frequently and on an ongoing basis.
Okay. You know, this one comes from Amber, and it's kind of what I asked you in the first question. Well, along that lines, what is Maui Memorial doing differently with this surge than you did during the March and April surge?
Okay, so let me briefly go back and remind us of the first surge.
Okay.
That occurred in March and April this year, and at that time, you know, we really learned a lot more about this virus and how it's transmitted and how contagious it is compared to other viruses. We also learned how long it can take before someone actually becomes positive. You have to wait for enough virus in your system to actually get that positive test. Now, during and right after that first surge, we put protocols in place, the no visitor policy, for example, universal masking, universal testing of all admitted patients, and then we also did like a double negative prior to discharge. You know, everything was trying to enhance our cleaning protocol and prevent any other spread within the walls of the hospital. We set up the employee screening and temperature checks to ensure symptomatic people don't enter the hospital, like I said earlier. We also ensure that everyone that enters the hospital is issued a mask. We've been trying to follow and adhere to all CDC and DOH recommendations, guidelines, or requirements for PPE usage, and I got to say that all these measures are still in place now. Of course, with the second surge, we've seen a rise across the nation, Hawaii, especially here on Maui as well, but thank goodness not as much as our friendly neighbor islands. And we continue to look for ways to better protect those within the walls from COVID. This time we've already, I should say, increased our PPE requirements. We're now including eye protection and gowns for any direct patient care, not just masks. We're also going beyond CDC recommendations for N95 usage as well. We learned more about limitations surrounding testing. So, of course, as I said earlier, you have to wait until you're sick enough or have enough viral load that we might not be able to detect you if you don't have that enough viral load yet. So anyone who's going to be admitted and wound up staying longer than the 3 or 6 days, we're testing on those days, day 3, day 6, in addition to the first day, if you remain in our care. We perform repeat testing on staff, high-risk areas, or the warm units. Maui Health has extended leave and pay benefits, child care assistance, so that our employees don't have to worry about loss of pay if they're feeling sick, waiting for a test, or if they need help with child care. I know everyone's tough and schools are still not fully operational right now. This helps keep our staff at home if they are symptomatic and they don't feel the pressure, help pay them while they're at home, increase the PPE education, of course, and utilization that is being implemented. So we're trying to see this is how you're supposed to use the mask, this is how you're supposed to wear it. If we're going to wear a mask, we got to make sure everyone's doing it correctly. We're always continuing to reevaluate our processes and see where we can improve. Additionally, I guess I should tell everyone that we're reminding all of our staff that we do all have a personal responsibility, both at work and at home. There is spread in the community, and when the numbers in the community rise, so will the numbers in the hospital. This is where everyone who's sick with really bad COVID would come to get care. We also, I found out, are one of the largest employers, especially right now during the pandemic in Maui County, and we reflect a small sample size of the community. COVID-19 obviously was not started or generated in the hospital. It wasn't started or generated in Hawaii. It was brought in from the community to the hospital, just like it was brought in from visitors and returning residents, and probably magnified because we are such a good, close community, and the hospital is an even closer, smaller community. It's good to emphasize it's important to follow infection protocols, wearing masks, social distancing, hand washing, and disinfecting when out and about.
One thing the people of Maui need to understand is that, this virus, as you said, back in March and April, you guys just started learning about it. There's many other viruses that you have the absolute answers for. And what people need to understand is that, you guys are going along with it. As you are going, you're learning yourself too. So, just because this is a health subject, you guys don't have all the answers immediately. As some of the questions, as you know, are pretty straightforward and they want immediate answers. But, they need to understand that, we're all in this together, meaning we're learning this together.
Yes, absolutely.
And we want to make sure that everybody, sends some pretty sane questions like this one. Why is the DOH now including antigen testing? And Dr. Vijak, can you explain to us what antigen testing is?
Okay. I'll try to be briefer.
Okay, yeah.
Antigen testing is looking for a small piece of the virus. It's something that's like that little pokey thing that you see on those little virus particles.
Got it.
Looking for the little purple dots that come off the side, not looking at the virus or the makeup of the virus. It's not as sensitive, but, for everyone else, you can swab your nose or swab the back of the throat. Sort of like that surge massive testing that's going on Oahu right now. Here on Maui, Maui Health uses a PCR testing. So PCR actually takes a piece of the virus and amplifies it.
Got it.
PCR COVID testing of course, is in a machine we call the Hologic Panther machine. It's considered one of the most reliable tests, type of tests and machines that are available that we got here. And it does take about 4 hours, and we're seeing with the increased amount of testing we're doing, maybe a little bit longer. I said this the last time, but just to reemphasize, like if you're positive, I tell everyone you're going to be the second person to know right after me. But if you're negative, we're going to try to call you. But if we can't, and you didn't hear back from me in the 4 to 6 hours, if you do get to go home, it's probably negative because our lab would have told us by then.
Right.
Now, the state chose to use the antigen test, which may not be as sensitive. But it's a good question probably to ask the state DOH. We definitely want to be the most sensitive.
Yes.
Our point is to try to catch every single potential positives we got, prevent any false results. So we plan on continuing using the PCR testing here, despite the 4 hours or longer to get the test results back, to confirm active COVID cases, until the next best and hopefully faster tests become available.
Again, just another one of the processes and procedures you guys go through and is implementing as we battle this COVID-19 and who knows for how long. Dr. Vijak Ayasanonda, always nice talking to you, my friend. Thank you for all of the hard work. Any last words?
Oh, I said the last time I was throwing a shout out to the poor people getting hit by the hurricane. I got to say, please take care, all you people who know any friends and family in California. Those wildfires are just terrible. Everyone's already suffering enough from COVID. I mean, we don't need anyone at all in the country needs any more fires. You know?
Yeah, true that.
Thank you, Shane. Thank
no
you,
problem.
KPOA, for helping keep our community informed and educated. I'll say if anyone wants to hear anything more, please visit mauihealth.org/safe. to learn more about all the ways we're trying to keep everyone safe.
Awesome. Thank you so much, Dr. Vijak. You have a wonderful day, and we'll talk again.
Thank you. Aloha.